Okay, great. So we'll do some introductions in just a moment. We're going to talk about Berkeley Public Health's mission, vision, and values. We'll also make sure to cover the program design, so information about the structure, timeline, a sample curriculum. We're going to go over the admissions checklist and timelines, and then we will have that an opportunity for Q&A. And then as Stephanie and I mentioned, we'll be incorporating Julia and Nasim, our two alumni who've joined us tonight. We'll be incorporating their experiences throughout the session. All right, so I'm going to kick off the introductions, but then I'll just hand things over to you, Stephanie, Julia, and Nasim to introduce yourselves. But my name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment. I am very lucky to work alongside Stephanie Nguyen, and the two of us are essentially your admissions and recruitment team. So we're here to support you as you learn about the program, and here to answer questions. So Stephanie, anything that you would like to share about your role?
Yeah, so as you, some of you may know, I work specifically with prospective students to just help you get acquainted with the program and support you through the application process. So if you ever have any questions about any programmatic logistics and things of that nature, definitely reach out to me, which I will leave my contact at the end of the session for you to reach out. I'm going to pass this along to Julia.
And Julia, if you'd be willing to share, obviously who you are, a little bit maybe about yourself, and then what you do currently for work.
Yeah, sure. Hi, everyone. My name's Julia. I graduated from the online MPH program last year, so 2023. So it was like half during COVID, half kind of not, which was interesting, but was super great. Right now, I currently work for Contra Costa County's Public Health Department, which is located in the Bay Area, East Bay Area, a pretty large county in this vicinity. I work for our hospital's quality department, so making sure when something goes awry, whether it's someone had a bad experience or there's something missing in an equipment piece for diagnostic imaging equipment, I take care of that. There's also people that come, the Joint Commission, they basically are the federal government. They come and do all these tests to make sure our hospital is safe to operate, making sure that things are all smooth and people know what they're doing, and coaching doctors and nurses on what to say, how to answer, so things like that. In my most recent project in my work, we're working on forming a patient and family advisory committee, which gives people and patients who have either received care at our facility or know someone or they care for someone who does to give us feedback anonymously so we can improve care here. Was that enough of kind of an overview?
Amazing.
Perfect.
Okay. Thank you. Nice to meet you all virtually.
Thank you so much. And Nasim, would you be willing to share a little bit about yourself?
Yeah, of course. Hi, everybody. My name is Nasim. Nice to meet you all. I graduated from the online on-campus program in December 2019. So that was before remote learning was the rule. Now it's back then it was the exception. And I actually recently started my role at UC Irvine Health in Southern California in Orange County. But in the past about almost 5 years, I was at Stanford Children's Hospital in Palo Alto. And my roles at the Children's Hospital and in my current role have really spanned quality and patient safety, similarly to Julia. So specifically in process improvement, or sometimes called performance improvement, transformational teams, all kind of the same thing, but really working almost as an internal consultant between multidisciplinary teams to help improve processes and make them reliable and consistent to give patients the best care possible.
Awesome. Thank you both so much for being here tonight. All right, so a bit about who we are at the online MPH program. Our mission is healthy people locally and globally. So what does that mean? To us, it means extending Berkeley's reach to improve population health, especially to the most vulnerable, and providing the tools to address the pressing public health challenges of our time through innovative and transformative online learning with rigorous and interactive curriculum, a flexible education experience that aligns with the needs of working professionals, empowering public health change makers to improve health where they live and in real time. Our values are service in community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. We won't dig into this so much right now, but really the rest of this presentation will focus on a lot of these topics. You know, what does an innovative and transformative curriculum look like? What does that rigorous and interactive curriculum actually look like as a person who's been through it? We'll talk about the flexibility of the program for folks who are working full-time and what it means to be a change maker in your community in real time. And the only other thing I would add here is, us being an online program is very much a values aligned decision that was made. We wanted to bring the UC Berkeley education to folks in the communities where they already live, where they already have influence, and give folks an opportunity, upskill people in their communities without having to relocate necessarily to the Bay Area. And then also for folks who are already making a huge impact in their workforce, in their place of work, for them to be able to also take advantage of the MPH degree by offering it in an online flexible format. So we're very much committed to this mission, and we'll start digging into it. I'll pass things over to Stephanie to talk about the curriculum.
Thank you. So as some of you may know, our units to complete the program is about 42 units, but for our online program, the time of completion is roughly about 27 months. Traditionally, there are some exceptions where you can accelerate the program to 24 months, or you can pace it and complete the program up to 5 years. But most students in our program complete the program within the 7-semester period. The program in itself is 6 units, and the format of the program is 90% online. So it's mostly asynchronously taught, with the 10% component where you are invited to the summer visits. These are mandatory as they are a part of your coursework. So right now we're actually welcoming our current students for our second year, which is really exciting. The course delivery in itself is that, as I mentioned, mostly asynchronous, but students can kind of work at a time of day that's most convenient to them. So I'm going to pause here for a second, and I actually would like to hear from Julia and Nasim, just kind of what your experience was like, as I imagine being a grad student, having to balance your time management and your personal life, academics, professional. How was that for you? And can you give us some insight on what to expect as a student going through this process or program? And we'll start off with Julia first.
Sure, yeah. It's definitely a lot to juggle work full time. I know, luckily I was in a position at the time that was pretty flexible and I didn't have to work super late. I mean, there were those certain days you do. But it was, for me at least, I try to have a healthy balance of work life and kind of what's going on here. But I feel like this program forced me to, because otherwise you'd be behind in things. I think balancing things, I don't know the structure of it now, but when I first started at the MPH program here, we were taking 2 classes at the same time, but then that was only for 1 semester. And then the next semester it was 1 class at a time, but it was more hybrid. So it was a bit quicker. And I thought that was a lot easier, though you're getting a lot of material in a short span of time. Being able to just focus on 1 class was nice, but I think it might vary depending on what class you're taking. But so the first semester it was 2 classes at the same time. So it was really dividing my week, kind of alternating what assignments or what lectures I needed to watch. Cause like they had mentioned, a lot of it's asynchronous. So it's kind of at your leisure. Sometimes I do it at lunch breaks if I took any, but is usually spent like a full day, like a full weekend day or like a half of a day, not a full day, it's a bit dramatic, but doing the assignment pieces, but trying to get all the content done for whatever the class was during the week. And I felt like when I didn't get the content of the course, like watching the lecture, reading the articles during the week, it set me to be a little bit behind. And then my weekends weren't as free, but you definitely have time on the weekends to do things as long as you prioritize what you're doing. And granted, there's going to be those times where you fall behind and stuff, but as long as you're very like task oriented, making lists of stuff, that's what I think saved me and helped me most.
And Naseem?
Yeah, very similar experience to Julia. I was working 8 to 5, Monday through Friday, and I had a 45-minute commute each way, 45 minutes to an hour. And so I would actually play the lectures. So I would watch them once, like sitting at my desk, then I would listen to them on my drive as a further reinforcement. And then later, I would probably squeeze out like an hour, maybe 30 minutes each night to work on the assignments, because I am really anxiety driven. So for me, it was like I just have to stay on top of it or else it would pile up. So I think really the key to success, in my opinion, is like, don't let it get away from you. Just stay on top of the assignments, and it's extremely manageable. So I think the weekly commitment there, an average of 15 to 17 hours, is pretty accurate. And of course, some courses you might already have some, subject matter expertise in that area, or you might be comfortable with the content, so you might even spend less time. But similar to what Julia said, like it's not going to be like a full weekend day. Maybe if you have a bigger project due, or maybe kind of towards the end of that semester, but if you break it up into chunks throughout the week and just stay on top of those chunks, then it's really manageable.
Wonderful. And in terms of your the flexible curriculum, as some of you may not be aware of, is that we offer the interdisciplinary concentration. It's housed with a few tracks such as global health, community health sciences, spatial data sciences for public health. We also have health policy and management, epidemiology about statistics, and one of our rather new ones, which I'm excited to share, is public health nutrition. So I'm curious of how you picked your courses. Did you feel that you stuck with your application and of what you started off with, or did you pivot at all? And what was your experience like in terms of choosing your classes?
Do you want me to go for it? Just go for, okay. Yeah. So I chose interdisciplinary because I felt like it gave me the most flexibility to take courses kind of all across the range, depending on maybe what spoke to me most. And I think just for the way I like to work, I like working on different projects that share similar qualities, but it's a variety of what you're doing, because it keeps me fresh and, more excited to be working and doing stuff. So that's why I chose interdisciplinary. But I think they offer a lot of courses specifically in the community health department. So that's kind of more of where I leaned. I wish there was more environmental health. I'm not sure if they're developing more, but that's one they didn't offer as many as I would have liked. Online versus in person. But I think there was an option where you can take in-person courses, just working full-time. It's like, I can't go to Berkeley from where I live and then go back to work. It's not that flexible for me, but I think with interdisciplinary, it just gave me the flexibility to choose if I wanted to take an epi course. I did take a spatial data analysis class on GIS software, which I thought was great because I thought that was super interesting and was actually really applicable to my work at the time. So that's the reason why I gravitated more towards interdisciplinary.
I was in the health policy and management track, and I pretty much stuck to the classes intended for that track. So there were, stats, there was like healthcare finance, there were, I felt overall, all of the classes that I took was like very applicable to what I wanted to be doing and what I'm doing right now. And there was just a lot of like tools that I was even using kind of at that time of taking that class.
Love that. Thank you. And I'm gonna move forward to that next slide. So thank you, Julia, for setting me up, because this is exactly what you mentioned. So coming into the program, students are going to take 2 classes at 15 weeks of instruction. And we do this to kind of slow down. You're transitioning into a whole new program, so we really need you to just take it easy a little bit before we start to accelerate the courses. And once you hit summer, this is where you are still registered for 6 units, but you'll take 1 course after the other. So that's the biggest difference between the two. And I know that you both had touched up on just your experience of time management and whatnot, but in terms of examinations and things of that sort, was there anything that like, how did you prepare for those kinds of classes? And I'm just thinking in terms of like a big question that I get a lot is, are you working with other students, and how are you kind of mapping out the program, or are you doing this alone throughout the 7-semester duration? Like, what you know what is your experience like in terms of studying and projects with other peers?
Yeah, I utilized group work a lot, which was great because so there's some class, I think most of the classes you have a group project that you're working on. So fortunately for my first class in the first semester, there was a group that I'd worked with, and they were all just great people. And we'd study together a lot. One of them lived locally, so I was able to like meet up with her in person, but most of it was done through Zoom. A lot of times we would do assignments, then it kind of like walk through like, hey, I had to like compare answers. Like, I got this on this one. Okay, you got that. How did you get there? So working through stuff like that. I attended a lot of office hours too. That's something that in undergrad, I wish I would have done more of, because people are there to help you. They like talking about what they know, and they're subject matter experts. So it's great to pick their brain about how to do things. Especially for me, like at least with biostats, it was just like I hadn't taken a statistics class in like 4 years. So it was like the file's there somewhere, but I need someone to kind of explain it in different terms. So the GSIs are great in the program, utilizing that help, and then study groups. So if there was anything really offered through the program itself, I typically would go to like a study hour session or whatever, but then often did stuff on the side with people who had similar schedules to me, or at least availability.
I definitely had a buddy throughout my cohort. She was in the same track as me. I'm still very good friends with her, but we would end up almost in all the same classes together. So she was like my study buddy. We'd always like at home, compare, like you said, like if you got this answer, how did you end up on with that answer? And then I think, like Julia said, there are a lot of group projects that you get to do, but if other folks are in the same like concentration or track as you end up seeing the same folks in classes, so you kind of get in your rhythm with the same group of people. Yeah.
Thank you. And just moving forward toward the practicum, for our program, we do require a structured pathway for students to get practical experience. And this is done through a practicum. So similar to what I would consider an internship to be, this is a great space for you to apply your coursework, your professional experiences into a structured project around whatever your interests are. So with this, it's a minimum of 130 hours at this moment. For our students can start as early as their 2nd semester and complete it no later than their 6th semester. So if we're to bounce back just for a visual aspect, you can start as early here, just got to wrap it up right before you do your comprehensive exam. So it's kind of a stepping stone to your comprehensive exam. This is something that I'd love to hear more about what you both did and how did you find it? Was it at your place of employment, or did you step out to, do something different? I'd love to hear a little bit more about that.
Yeah, so I first wanted to do something internally, still in contrast health, public health department, but it wasn't as fruitful and things weren't moving at a quick pace. So I would have zero patience. So I was like, okay, I got to start this thing because I don't want to wait till the last minute, but it ended up being pretty last minute. So I did that to myself, but I actually did mine through UC Berkeley with the student health insurance program. They had never audited their how people felt about the services that they were getting or the providers or anything. So I developed this survey to be sent out to all the people that were on SHIP, the student health insurance program, for them to give feedback. And then I set up these groups where people could provide feedback in person. And it's something that I had done when I first started my career in public health. I would go to shelters where people experiencing homelessness would live, and I'd ask them about the services they were receiving and how we could improve. And then that was part of my project. So it felt just kind of something that I felt confident and good at, but would like to fine tune skills and use what I've learned in the classes to apply it to something that's like a bigger organization. And then, yeah, I'm doing it now in my work with this patient and family advisory committee, but I wish I would have started it sooner. That's one thing, or at least started looking sooner. And I think doing more informational interviews earlier on is something that's helpful, just to kind of pick people's brains. Because again, people do love talking about what they do when they do like what they're doing. And that's something that I wish I would have done earlier on, just out of curiosity. And it only helps you networking wise anyway. So you might as well. And I think just utilizing, I think it's a handshake. And there's, I think some of the advisors are still within Berkeley. Candace was someone that I had utilized, just kind of like, is there any other places I can look? But yeah, my tip of advice is start looking sooner than later. And if you do take a class and you're like, I really think this is the path I want to go, I'm going to look for an internship in that path, or even a career that you want to be in, aim in that direction and kind of try and see if there's something available there.
Very awesome. We actually still do use handshake, and Candace is still here. So glad that you were able to bring that back. And Naseem, is there anything that you'd like to share in regards to the practicum? I'd love to hear from you.
Yeah, so for me, I actually when I started the program, I was working for a medical device manufacturer in the process improvement realm, and I knew I wanted to be in the healthcare delivery space, so that I really leveraged my MPH to kind of make that jump from medical device to healthcare. And a lot of my classes, because I was in the health policy and management track, were like healthcare management sort of classes. And at that time, there were a few that were taught, or at least had a lot of Kaiser Permanente alumni presence. And so through those classes, I got to learn a lot about the summer internships that Kaiser was offering. So my practicum was actually a summer internship at Kaiser Permanente Clinic in San Francisco. And I had actually basically left my job in medical device manufacturing, did the 3 months paid internship at Kaiser in San Francisco, and then started at Stanford Children's. So it was really like the bridge to a career in healthcare for me, which is very cool. And it was really to the credit of the program to have all these connections with different healthcare organizations that allowed me to do that.
That's amazing to hear. I love both of your pathways and just being able to explore and map it out. I can see just the motivation behind what you want to do and just how it all played out. Amazing. So I'm going to pass this back to Elise to cover a little bit more about the cost of attendance.
Thank you. Yeah, so obviously paying for the program is a big part of attending graduate school. And we wanted to go over what you can expect in terms of program fees. So right now, the cost of attendance is $1,470 per unit, and it's 42 units in total to complete the program. There's also a few fees that would be associated with attendance. So there's the Berkeley campus fee, and some folks, wonder like, where does the campus fee go if I'm an online student? And the campus fee is a couple things. So in part, we always say that first and foremost, you're a UC Berkeley student. You're not an online student first, you're a UC Berkeley student first. So you do have access to campus amenities like the library. You have access to counseling services that are offered through the university. You also, if you are proximate to campus, can come to campus and use those resources. It also helps with, Julia mentioned like Candace, who's on our RISE team, they help with practicum. So the folks who sort of support you in your practicum journey, things like that. There's the, Julia also mentioned SHIP, which is our student health insurance plan. Now, you have the option to opt out of SHIP if you already have health insurance by another means. So for instance, if you are working full-time and your employer offers health insurance, you do not have to use SHIP, but if you do, that $3,000 is the cost associated with that. There's a document management fee and our instructional resilience and enhancement fee. And that goes to our whole team of instructional designers who work to make our online program engaging. They work to make the curriculum and the lectures and all of the content make sense in an online format, make it user-friendly and accessible, and updating the coursework and curriculum, as new information becomes available and things like that. So we like to make sure that everything is as current as possible. So that brings the total cost of the program to a little over $68,000 if you're waiving that student health insurance fee. And there's a few avenues that our students may take to pay for the program. So one route is being self-funded. So some of our students, if you're working full-time or you have other means, they'll cover the full cost of the program out of pocket. And there's, things you can take advantage of to make that more feasible. So first of all, you're only paying for the units that you're enrolled in that semester. And then there's fee payment plans that break that semesterly tuition payment down even further. So you could break it into monthly installments or as many as 5 monthly installments to kind of keep the payments down. A major resource that many of our students take advantage of is federal student aid. So you would begin this process by completing your FAFSA, your free application for federal student aid. And one thing I like to call out when we're talking about federal student aid is that at the graduate level, federal aid will be unsubsidized student loans. So it is a bit different than if you used federal aid for your undergraduate. There's a lot of grants and things like that don't require repayment. However, at the graduate level, federal aid would be loans that do require repayment. Now, that being said, it's still an excellent resource and one that many of our students use to help pay for the program and to help pay for things like living expenses and things like that while they're enrolled. Now, one option that we've had folks take advantage of as well as employer sponsorship. So this, there are a number of employers that might offer a tuition benefit as part of their benefits package. So we always encourage folks to talk with their employers and see if that's something that might be available to them. And then we have a few scholarships that are offered as well. One is the Dean's Health and Equity Leadership Award. This is a needs-based scholarship that would cover the equivalent cost of 7 units. And then for the spring of 2025, which is our current application cycle, we are also accepting applications for the Rural Health Innovation Program. And this is actually a fully funded scholarship that's available for folks who are living and working in rural communities. So definitely worth checking those out. And with that, Julia and Naseem, I would love to ask, would you be willing to share a little bit more about what strategies you use to help finance your education?
Yeah, so I was fortunate enough to not have to take out student loans when I was an undergrad. I also went to Berkeley as an undergrad, but my parents had to put themselves through college. So I know this is so fortunate, but when we were born, my sister and I, they had put money away on the side, definitely made huge sacrifices for themselves. So we didn't have student loans coming out of our undergrad. So graduate school, it was something kind of I wanted and elected to do. So I was fine, obviously paying for it, but I could not afford to pay for it out of pocket, especially working for a county government. They definitely don't compensate you like a private sector necessarily would. So I did take out a FAFSA loan. I'm paying it back now. And it's like, I think it's pay by your income basically. But fortunately for me, because I do work for the government, after paying or making 120 payments, so paying for 10 years, they pay back the rest of my student loan. So by that point, I think I would have only paid back 40,000 over 10 years. And then the extra that accrued on there, I would be getting $20,000 basically off of college, my grad school. So to me, it was worth it to do that, just because I already think that school should be a lot cheaper than it is, but it's worth it to me. So that's why I decided to take out the loan.
Also did the FAFSA, and I took out loans, and I paid what I could while I was working. But the majority of it was loans. And then when I worked at Stanford Children's, they actually allowed tuition reimbursement. So I would also not just look at like having your employer pay when you're in the program, but some employers will actually, sorry, not tuition reimbursement, but student loan reimbursement, basically. So some employers have programs where they will actually help you pay down your student loan. So at Stanford Children's, we got an allotment each year, which we could either use for like any new education, conferences, classes, books, whatever, or we could allot that amount towards paying down student loans, which I got to do during the time that I was there. So yeah, so I would encourage you to explore also like retrospective student loan payment programs.
That's fantastic. Thank you both for sharing that. I think, yeah, I'm so excited to learn that you both have like some loan repayment options. Those are so beneficial and important for graduate school. And I'm excited that you're able to take advantage of those. All right, so now we're going to transition to our application content. We are in the midst of an application cycle right now, so some of you may be looking at applying for spring 2025. That application will close August 8th. And we have a few application requirements that we're looking for. To start with, we have some prerequisites: statistics or college level math with a B+ or higher. And we are looking for a minimum of a 3.0 GPA. Now, a couple notes on these for stats and college level math with a B+ or higher. Essentially, the reason for this is we do kind of kick you off in some biostats. You'll have some epidemiology courses, and we just want to make sure that you are prepared for those, since they are typically offered in your first semester. And then the GPA, the 3.0 GPA, we do still consider your application if you don't have a 3.0 GPA from your undergrad. So we do a holistic review process. We take into account all of your application materials. We review your transcripts for things like upward trends in your GPA. We look at your work experience, your letters of recommendation, and we read the essays that you submit to us to try and get to know you. So we really do evaluate you holistically. So don't let the 3.0 GPA deter you. You can always have a conversation with Stephanie or myself, and we can talk through ways that you can make your application competitive if you aren't meeting that minimum GPA. Now, I'll run through these kind of quickly, because then I'd love to invite Julia and Nasim to share a little bit more. But for the advanced GPA calculation, essentially what that is it's your GPA from your last 2 years of undergraduate university. And again, that's because for most folks, those first 2 years of college are a transition period. So we want to give you the benefit of the doubt and just look at your last 2 years of college. We also require 2 essays, your statement of purpose and your personal history statement. Your statement of purpose is really, why this degree, why the MPH degree, why UC Berkeley, and why now? Why is this the degree for you at this moment in your life? What are your goals? Why is this degree instrumental to you obtaining those goals? Things like that. So, it's a lot about you explaining to us why the UC Berkeley Online MPH is really the place for you in this moment and how that will help you achieve your future goals. Your personal history statement is more you sharing with us who you are as a person. So all of the lived experiences you have that have led you to public health, the things that make you unique that you're bringing into the program, and it's really your opportunity to tell us who you are in your own words. So both of these are really important parts of your application, and we always recommend spending some time on those. We also require 3 letters of recommendation from academic or professional sources. We do need to see all of your transcripts from all of the institutions you've attended. If you are an international student, you can provide us a WES ICAP. We require your resume or CV with your work experience. And there is an application fee, $135 for US residents, $155 for international applicants. And if you completed your undergraduate outside of the US, we may require a TOEFL or an IELTS exam demonstrating English proficiency. And then lastly, our GRE is optional. So you are not required to take the GRE in order to apply, which is great. So with that, Julia and Naseem, I would love to sort of hear from you, first of all, just what was your experience applying to the program? And then as a secondary question, I'd love to hear sort of how you approach the essays, because those are two questions, that's kind of a question that Stephanie and I get a lot, is what do I focus on in my essays? So if you'd be willing to share a little bit more about your application experience, that would be great.
Yeah, I originally wanted to go back to school, I knew, but I didn't know what for. I had done or wanted to do nursing for a bit of time, and then realized like, okay, you're kind of, not that you're doing the same thing every day, but there's like, if there's a problem, there's always something upstream that controls it. So then I was like, public health is more broad. So I'm going to try and go to Berkeley because I'd already gone there once and I enjoyed it. So I was like, we'll see what happens. And if this happens, if it's meant to be, it's meant to be. So once I was obviously accepted, but in my essay, I used a lot of my experience I already had. So I've been working for the county for quite a while. I graduated undergrad in 2014 and went right into working with this program called Healthcare for the Homeless, and had been working with them up until I think 2021. So like right before applying to this program. And that experience, just working with the most vulnerable population at the time, I think just made me realize that there's so much that people outside of what my program was doing don't know, and that there's so much change that we can't do because of all these outside factors. So I think just wanting to be able to do more, but not knowing the correct way or avenue to do that. And I feel like too, in public health, just in general, not that people don't take you seriously, but the opportunities, at least specifically in government too, if you want to rise the ranks and have different positions where you're paid more, an MPH is kind of, you need to have some sort of extra degree. So I knew that, okay, well, if I want to make a change, I need to have a higher position, but to have a higher position, I need to have a degree. So that's what kind of routed me to the MPH program. But in my essay, I wrote about kind of essentially that, just like, I want to make a change and I need to do that with a degree, and I'll get that experience and the exposure on how to do that. So my essay was more elegant, obviously, than that, but it was more or less mention those things.
So thank you.
I truthfully cannot remember what I wrote in my essay because it was forever ago now. But I know that for the personal history statement, I just wrote about my own experiences as someone who's like, a part of an immigrant family with taking care of my mother who doesn't speak English, and really like experiencing the equity part of public health kind of firsthand. And and then talking about, you know, why I wanted to kind of just be in healthcare and how an MPH would help me be effective in healthcare. And then what's actually interesting about my whole application process is I think I had applied when I had just under 2 years of work experience. So my first go around, I was actually rejected from the program, but Evan, if you all know Evan from the program, she's one of the directors, she called and left me a voicemail, and I ended up talking to her, and she talked about how like she read my essays and like really thinks I should be part of the program, but I just need a little bit of work experience. So when I applied the second go around, that's when I was able to get in. But I just appreciated that, like, wow, they really do read all the essays. That's a lot of essays to read, and they take those things into consideration. So yeah.
Thank you both so much. Yeah, I think I appreciate you calling that out, Naseem. Yeah, our faculty, they are so thoughtful about reading all of the application materials that are submitted. And so when we share that it's a holistic review process, you know, I can definitely attest that it's true, and the faculty really care. And, you know, sometimes as you experience, Naseem, it'll be you know, might be a suggestion that you get a little more work experience, or like develop another, you know, take one more class, you know, something to come back a little more prepared for the program. And so our faculty do sometimes give that advice, and so sometimes a no is just a not yet, but we hope that you join us soon. All right, and these are just some notes on our upcoming deadlines. So for our our fall application period has now closed. We are accepting applications though for the spring start, which is our January 2025 start. We will accept applications until August 8th, and then we'll be releasing admissions decisions in usually late December to mid-October. So we hope that we see your application in this next cycle. And I'll pass it back to Stephanie to talk. Oh, I'm so sorry. This one's me too. Sorry, Stephanie. Yeah, so we just wanted to highlight some of the outcomes that our students have. Our 2023 graduates reported an average salary of $111,000. So we're excited to see that number. And we have folks who do all sorts of roles within the public health sphere. So data analysts, financial analysts, community health program specialists. I mean, you can see on here, we have folks who are engineers and attorneys. You know, there's folks who go into academia and data science. So it's such a broad spectrum. But Julia and Naseem, I'd love to hear, you know, what are some specific skills or experiences you had in the program that you felt like directly impacted your career?
I think for me, it was not knowing what you're already doing, but then kind of putting a name or a title to it. So I know Naseem mentioned a lot of like performance improvement measures of stuff. So it's like, I kind of knew that I didn't know I was doing that, but then with these classes taking at Berkeley, it was like, oh wait, I know how to do this, but this is kind of like the analytical term and what makes sense and kind of what people understand, you know, these big entities when you're presenting or you're showing or trying to make improvements. So I think a lot of that, that language, key performance indicators, that type of stuff, a lot more around like quality, just things that, again, that you knew that you were already doing, but then it was like, wait, I know how to do this. So it was like applying things to kind of elevate it a little bit. So I think it was kind of fine tuning stuff like that for me.
Yeah, I agree with that. Like for me and some of my healthcare management classes, we would read a lot of Harvard Business Review articles on things that I was like, oh, now like I can see where I would apply this tool or how I would use this. Even like things I'll never forget because we did our negotiations class over the summer. And that was a lot of fun because you don't think that you really need to learn negotiation, but you're really negotiating in every facet of your life for different things. So just the applicability is really great. And I will add just seeing the recent job titles, what I loved about the program was the diversity of the other students in my cohort. I mean, you had people that were like working for the CDC, you had people that were re-entering the workforce after having their children, but they're doctors, and so you just get such a wide array of people that you can really learn from, in addition to actually learning from the classes.
Awesome. Yeah, I love that. We always say that our students are a huge part of what makes the program so successful. All of the experiences that you all bring enriches the classroom experience so much.
Yeah, and as we come to a close soon, I just want to, there's many reasons why I would personally say, why UC Berkeley's online MPH program, but being that we have two amazing, amazing alumni in with us today, I'd love to turn it to you and just kind of pick your brain and figuring out, why UC Berkeley, and you mentioned it throughout the session, but when it comes down to it, as a working professional, as somebody with lots on their plate, what was it about the program overall that really just said that's what I'm going for?
Yeah, I think, again, doing undergrad at Berkeley, and I loved my experience there, which was why I gravitated towards going to Berkeley again for the MPH. But I think since being there, like Nasim had mentioned, you're working with and taking classes with people from such different backgrounds of things, not only in their personal experience of life, but just their work life too. So, and I mean, that's a testament to Berkeley, that it's a very diverse place. And it is true, because there's, I don't know, like I think one of my classes, there was like a principal of a school, and he was wanting to do something in nutrition. I was just like, this is so funny. It's just such a wide range of people. But they all everyone shares common ideals that they just want to make things better for people collectively. So I think that's just something that's refreshing about Berkeley always, is that you don't feel like you don't fit in there. And I think it gets this bad rap too, of like being all these smart brainiac people, and it's intimidating to go into, but I think that people are kind, and which is something that you don't expect. I think for me, undergrad was a little bit of a different experience academically wise, because it's a lot of competition there, but grad school, it seemed to be a lot more, everyone just wants to succeed, because everyone has lives outside of school, outside of work, that they're trying to navigate and handle. And that's something that I could say was a better experience in my undergrad, was that like, wow, okay, this isn't the competitive, like you're hiding your lab from me, you're doing all these weird things. It was like everyone wanted everyone to succeed, and it felt more community driven.
Yeah, and to add, I think for me, it was the value that you get out of the program. So the cost and the time that it takes, I feel like you just get more out of it at the cost that the program is offered at, compared to other online MPH programs. And then also, I think living in California, and then during the program, I moved to the Bay Area, but like having that close proximity to be able to do things on campus, or like even meet up with your classmates in person. Like Julia mentioned, there are classmates that we were working on group projects together, but we could just go and meet up together. I thought that was a really nice addition to it. And I think the 10% on campus is really the fun part, where you get to see the people you've been talking to online on the different discussion forums for your classes. And it's a really fun time of being able to connect with people. And I would also add that UC Berkeley is just really well connected to a lot of organizations. So for like, if you're trying to make a career move, or if you want to learn more about like trying something new, then you definitely have that opportunity at UC Berkeley with the connections that the university has.
Thank you for that. And I would also agree the negotiation skills course is amazing. I just feel like if there's anything that should tell a student why Berkeley, it's that class for sure. And also the intro to health and social behavior, I think, is a really fun course for students to also take too. As we close out, if you're interested in learning more about the Rural Health Innovation Scholarship, we'll have a whole dedicated webinar specifically for that. We'll talk about eligibility, what's required in that, and just a little bit more in detail. So that will be coming up pretty soon, Wednesday, June 12th at 2 p.m. Pacific time. As always, if you can't make it, these are recorded. So We would love for you to follow us on our socials as well. If you ever have any questions, you can always reach me at online.mph@berkeley.edu. But I'd love to open this up to the floor for anyone to ask some questions, maybe about, again, navigating remote online learning and your experiences. If you have somewhere, if they want to get to the logistics, I will invite you all to either use the hand raise feature. You can type in your questions, use the Q&A, whatever works best. And thank you so much, both Nasim and Julia, for joining us today. It was amazing, amazing, amazing. Bria.
Thanks, Stephanie. I'll put myself on camera. So just want to say thank you for this. It's really helpful just to hear from you all about just the program in general and all the experience that you guys had in terms of navigating work and doing this part-time. It's been really, really insightful. So thank you for that. My question that I had is more so just around a logistics question. What are the typical average cohort sizes for the program?
Yeah, so we ideally like to admit around 60 students each cohort, give or take. So we have had some cohorts that were a little smaller, like 40 students, and some that were larger, like we've had as many as 80 students, but 60 is sort of our goal.
Awesome. Thank you.
Oh yeah, so
go
sorry. So I see your question, and I think you're referring to like the different concentrations, so interdisciplinary, epidemiology, nutrition, or health policy and management. So the sizes within those specializations do vary. This term for fall, usually epidemiology and interdisciplinary are larger groups, like 20 or so students in each of those. And then usually nutrition and health policy and management are a little bit smaller, like 10 to 15 students, potentially in either of those tracks.
I want to mention too, back to Bria's question, even though your cohort is only 60 people, I feel like because there's different times people are admitted, there's a lot of kind of like cross-pollination. So you do have like your core people that you're with, but the summer visit, I remember being like, oh, they started a semester after me, or they just started this last semester. So there's a lot of, even though it's that only 60 that you're starting with, the variety of who you're having access to, it's like you have some people from before, some afters, depending on when people take classes. So that's something too that is cool about the program.
Awesome. That's good to know. Thank you.
So just bouncing back to there we go. The question, if you're interested in applying for the soonest start time, spring 2025 is open right now. That means you'd start in January of 2025. And the applications are due August 8th at 8:59 Pacific Standard Time. It is a little bit earlier because it's an East Coast application system. So just make sure to remember that. The decisions will release usually around late September to mid-October for the spring applicants. But if you're thinking about a later term, we typically release applications sometime around September. So you'll just want to check back for the next academic term.
I have a question just around the interdisciplinary track and kind of just how in the interdisciplinary track would you know in advance that kind of your particular interests or goals can be met within that?
Yeah, that's a great question. So, the place I would start is you can actually see the full curriculum on our website, and there's within the interdisciplinary track, there's a few core courses that you will definitely take, and then there's a huge variety of optional courses so that you can build your track or your specific interest area. So, I think I would definitely start there to see if there is coursework that you can take within the interdisciplinary track that aligns with your goals. But Julia, you were an interdisciplinary student, so I'm curious what your experience was, kind of building a curriculum that worked for you.
Yeah, well, I knew I wanted to do definitely community and environmental health if I could. Like I had mentioned, there's not as many environmental health classes offered online so much. So the closest I had got was like the GIS spatial data class, which I really liked. But I did utilize the planning ahead thing where they lay out the classes when they're offered and kind of was like, okay, if I take this, then it's offered again here. So I could take that there. So I think just trying to, whenever you're starting, map it out that way and just lay out your options of what you can choose helped. And then just reading about the course too. And it's like a little bit, you need to do a little bit of research to see. And then asking too, like colleagues in your class, like, hey, have you taken, like if they started in the spring and you're starting in the fall, like, hey, what classes have you already taken? What would you advise? You can always get my contact information. I can tell you what classes I've taken or ones that I was like, oh, that one was okay, but maybe I would have skipped it. Yeah, so I think just asking around and then kind of doing your due diligence on the back end. But it is nice that they do lay out what classes are going to be offered when, so you could kind of plan out what you're going to take ahead of time.
Thank you.
Yeah.
And I see we're almost at time. Oh, I'm sorry, Elise.
Nope.
Okay.
I was just going to call out, Fred had a
Yes.
question in the chat if we have time for one more.
Yeah. So how much of the assignments, tests, or deliverables are individual versus group work? So Naseem and Julia, I'd love to get your perspective on what that balance was like. Was it pretty split? Was it 90% individual? I know you mentioned a little bit about it, but if you want to, if you care to elaborate a little bit more.
Do you want to go, Naseem, and then I'll answer after you?
Yeah, you can fact check me on my.
I'm sure it didn't change that much.
I think for me, it was like 70% individual and 30% group. Like each class usually had a group element to it. And of course, you could form study groups with people and make it more group oriented. A lot of like the individual assignments, obviously are individual. And then a lot of the classes for me had discussion forums. And so that's kind of like individual and group because you're basically, conversing with your classmates asynchronously on a discussion forum. And then the tests, if my memory is right, they're all individual, some are open note, and for me, I would just schedule time at the proctoring center and then just go and take the test, when I had the time.
Yeah, I think you hit it all. Group project, I think almost every class had a group project, whether it was big or small. I think it varied on what class it was. But yeah, majority of it's individual, but definitely a group project. So make sure you speak up if someone in your group isn't doing work, because I didn't do that soon enough. And it was like the end of the semester, and I was like, me being the type A, trying to make sure everything was perfect and fine. And it was like, I'm spending so much time, like, what the heck? This person's going to get a grade that you do everything. But that's, I think, just group work in general. So be mindful of that for yourself. The tests, yeah, like Naseem said, I didn't do any in person, though I live close to Berkeley. I just did them all online, and it was proctored that way for me. And most of them are open note, that type of thing. If they're not, you're okay. They're not too crazy.
Awesome. Thank you so much. Well, I want to be respectful of everyone's time. So we are going to go ahead and close out, but if there's any questions we didn't get to, Stephanie and I are more than happy to connect with you, and you can email us at online.mph@berkeley.edu. We also have more info sessions coming up. Stephanie graciously offers advising appointments every week. So, if there's any questions we didn't get to, we would still love to connect with you. And with that, thank you, Julia and Naseem, so much for joining us tonight. And thank you to everyone who spent an hour with out of their evening learning more about the program with us tonight. It was great to see you all.
Thank you.
Thank you.
Thank you.